Welcome to Ulosca channel. Access all WGU practice questions. Cultural awareness practice questions with answers.
Question 1. A nurse is caring for a patient from a culture where family consensus is valued before making health decisions. What should the nurse do? A. Make the decision for the patient to avoid delays. B. Allow time for the family to discuss and decide together. C. Speak only with the eldest male in the family. D. Provide written instructions and leave the room. Which one is the correct answer? The correct answer is B. Allow time for the family to discuss and decide together. Explanation. Allowing time for family discussion respects cultural norms that prioritize collective decision-making and supports patient comfort. Question 2. Which term refers to the process of adapting to and adopting elements of another culture? A. Inculturation. B. Acculturation. C. Cultural imposition. D. Ethnocentrism. Which one is the correct answer? The correct answer is B. Acculturation. Explanation. Acculturation is the process of adapting to a new culture while incorporating some of its values and practices into one's own life. Question 3. A nurse assumes that all patients from a specific ethnic group have the same dietary preferences. This is an example of A. Cultural humility. B. Stereotyping. C. Cultural competence. D. Cultural relativism. Which one is the correct answer? The correct answer is B. Stereotyping. Explanation. Stereotyping is making generalized assumptions about people based solely on their cultural or ethnic group without considering individual differences. Question 4. A patient refuses a blood transfusion due to religious beliefs. What is the most appropriate nursing action? A. Explain that refusal is unsafe and proceed with the transfusion. B. Respect the patient's decision and explore alternative treatments. C. Call the family to persuade the patient. D. Ignore the refusal and inform the provider to continue. Which one is the correct answer? The correct answer is B. Respect the patient's decision and explore alternative treatments. Explanation. Respecting the patient's beliefs supports autonomy while exploring safe alternatives that align with their values. Question 5. Which approach best demonstrates cultural competence during patient assessment? A. Using a certified medical interpreter for non-English speaking patients. B. Asking the patient's child to translate. C. Speaking louder and slower to the patient. D. Avoiding discussion about cultural beliefs to save time. Which one is the correct answer? The correct answer is A. Using a certified medical interpreter for non-English speaking patients. Explanation. Using a certified interpreter ensures accurate, confidential communication and avoids misinterpretation or privacy breaches. Question 6. When providing care for a patient from a culture unfamiliar to the nurse, the first step should be A. Apply the nurse's own cultural norms. B. Research the patient's cultural background. C. Avoid asking questions about the culture. D. Defer care until a culturally matched provider is available. Which one is the correct answer? The correct answer is B. Research the patient's cultural background. Explanation. Learning about the patient's culture helps the nurse provide respectful, tailored care and prevents misunderstandings. Question 7. The belief that one's own culture is superior to others is known as A. Cultural sensitivity. B. Cultural relativism. C. ethnocentrism. D. Assimilation. Which one is the correct answer? The correct answer is C. Ethnocentrism. Explanation. Ethnocentrism is the belief that one's culture is superior, which can create barriers to culturally sensitive care. Question 8. A nurse caring for a Muslim patient during Ramadan should anticipate that the patient A. will not eat any food for 30 days. B. may fast from sunrise to sunset and eat before dawn and after sunset. C. will require a vegetarian diet. D. will fast only on weekends. Which one is the correct answer? The correct answer is B. may fast from sunrise to sunset and eat before dawn and after sunset. Explanation. During Ramadan, Muslims fast daily from sunrise to sunset and eat before dawn and after sunset. Care planning should respect this. Question 9. Which of the following is an example of cultural humility in nursing practice? A. Assuming the nurse's approach is the best method. B. Continuously reflecting on personal biases and being open to learning from patients. C. Using the same care plan for all patients regardless of background. D. Avoiding conversations about culture. Which one is the correct answer? The correct answer is B. Continuously reflecting on personal biases and being open to learning from patients. Explanation. Cultural humility means ongoing self-reflection, awareness of biases, and openness to learning from each patient's unique experiences. Question 10. A nurse is caring for a Native American patient who prefers traditional healing practices. What is the best approach? A. Discourage traditional practices and promote Western medicine. B. Collaborate with the patient to integrate traditional healing with medical treatment. C. Refuse care until the patient stops traditional methods. D. Ignore the patient's preferences to maintain consistency. Which one is the correct answer? The correct answer is B. Collaborate with the patient to integrate traditional healing with medical treatment. Explanation. Combining traditional healing with medical treatment respects cultural beliefs and promotes trust while ensuring safety.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.